1 o'clock here, so we'll be getting started. Alrighty, yeah, it looks like everybody found the chat area already. That's good. Okay, so thank you all for coming to the newest edition of the Medical Monks webinar series, the Monk Posium. We are very, very pleased to have with us today Wil Walker from Hollister Incorporated. Wil is a wound ostomy and continence nurse who has been with Hollister for 15 years. He is currently a clinical resource manager for US Ostomy. Wil is responsible for clinical support, presenting educational content, as we are here, engaging with key opinion leaders, and he leads the Hollister US Ostomy Clinical Advisory Board. Wil completed his WOC nurse training at the Cleveland Clinic. So we'll be doing in just a second a presentation, and then afterwards we'll have a Q&A. As you can all see over to the side, there's the chat. If anyone, just go right ahead and put your questions over there in the chat. I'll be monitoring while Wil's doing his presentation, and then I'll be back to moderate the Q&A at the end. So without further ado, please take it away, Wil.
Thank you, Adam. Let's get started here with our slides. Welcome, everyone, and thank you to Medical Monks for the capability to be in front of this lovely audience today. As you guys well know, I can't see your faces, but hopefully you can see my face easily and also see the slides that are on screen. Our purpose today is really to give a quick overview of some of the recommendations related to product selection when it comes to managing some of the more commonly seen ostomy complications that it can occur from people like yourselves who are ostomates, or certainly the people who support if a loved one of yours is an ostomate. A lot of the tips and tricks that we're going to give today are things that are acceptable and generally acceptable from ostomy nurses. A lot of the content, as a disclaimer today, is based off of showing you Hollister products. And we realize that many of you may not be Hollister wearers. If you are, we certainly thank you and look forward to continuing to support you along your ostomy journey. If you're not a Hollister user, Medical Monks as well as Hollister is happy to support you with some of the recommendations. So just wanted to give that disclaimer that all of the images that you will see are from Hollister products. And a lot of what I will mention is generally acceptable across the spectrum. So if you're not a Hollister user, if you're using a non-Hollister product, a lot of what we will go over is offered by other companies, likely the ones that you are already using your products. So just keep that in mind. We'll get started. So what causes ostomy complications? More often than not, it is exactly what you see on the left side of the screen here, which oftentimes is related to leakage. Whether you're a fecal stoma, meaning you have an ileostomy or a colostomy, or you're a urostomate where urine is coming out of your stoma, the principles of pouching around your stoma are the same, regardless if it's an ileostomy, colostomy, or urostomy. For urostomies, you're going to wear a different type of pouch, of course, but for a fecal stoma, you will wear a drainable pouch. Regardless of fecal or urinary stoma that you have, leakage is oftentimes the main complication. And that's oftentimes due to the fact that, you're moving, you're sitting in a chair, you're driving your car, you're bending up to pick something off of the floor. All of that changes the shape of your belly. And if you're like the majority of people who have a stoma, and the majority of people in general, when we bend over to pick up something off of the floor or we sit in our chair, the shape of our belly changes. A lot of the creases and folds that may not show up when we're standing up straight or laying down flat in a bed, those creases and folds on our belly start to show up. And that's where we can allow stool or urine, depending on what type of stoma you have and what's coming out of it. That's where the opportunity arises for that stool or urine to start leaking within those creases and folds. So our ultimate goal in ostomy care is to prevent that leakage and keep your skin healthy. Again, hopefully you may not have had the chance to experience redness like you see around that stoma on the left side of your screen. And if not, that's a great thing. But unfortunately, the evidence that's been generated in the medical community, it shows us that the majority of ostomates will experience along your journey some level of skin complication. And our goal as a manufacturer, through the products that we make for you, the services that we offer you, the education we continue to try to provide to you, is all geared around trying to prevent that leakage ultimately, and also focusing on keeping your skin very healthy. And that is, again, the ultimate goal in ostomy care. So leakage is the number one cause of complications, along with some what we call mechanical trauma. And that's essentially pulling your skin barrier off of your skin too quickly. Or, you're a cancer patient and you're having some radiation or some chemo, and that creates a sensitivity on your skin. So again, our ultimate goal in ostomy care as an ostomy nurse practicing and recommending products and services to you and your surgeons, your colorectal surgeons offering care to you, all of us together, our ultimate goal, once you do have that stoma, is to keep your products from leaking, prevent the leakage, and also to keep your skin healthy. And sometimes it's achievable with only pulling that ostomy pouch out of the box that you get from Medical Monks or your suppliers or your manufacturer. But the ultimate goal in all of that is to make sure that we're trying to keep it as simple for you as possible without overwhelming you. We do have services available to you. Again, speaking on the Hollister end, we've got Secure Start services it's a phone call away that essentially gives you a lifeline in the instance that you can't get in touch with your ostomy nurse or your healthcare provider. But it is ultimately our goal to prevent the leakage, to keep your skin healthy, and allow you to do so with using the minimal amount of things as possible. But as we go through this presentation, I'll show you some of the products and kind of mention some of those commonly seen troubleshooting items that we can hopefully help talk you through. Again, we'll focus on preventing leakage and some of the products available to prevent leakage or help prevent leakage. And then we'll also talk about some of the products that help prevent that barrier edge from lifting up, that give you some odor management should you have odor concerns. And we'll, again, focus on all of those as we go through this. What leads to those complications? Again, this is a quick graphic just to show you this top image here. Hopefully you can see my mouse hovering around that left top picture. That is ultimately what we want your skin to look like. This is a light tone skin person shown on the screen. So it's dark tone skin ostomates. Oftentimes you can't necessarily assess their skin as easily. So the only way to truly assess what your skin looks like is to actually pull that skin barrier off, look down at your skin, and make sure you're assessing that at every barrier change. If you start to notice any redness of any kind, it oftentimes is likely that we need to adjust the size of your skin barrier. If you haven't done that, it's important to measure your stoma at every time you're changing that pouch, especially if you're within the first 8 to 12 weeks after surgery. After those 12 weeks, or sometimes a little bit longer, sometimes a little bit less, you're becoming more accustomed to using your product. But because of the swelling that's happening right after surgery, your swelling continues to decrease, and you need to adjust the size of your stoma barrier. We don't want any skin exposed around your stoma, or that can allow that stool or urine to sit on your skin, which will ultimately start to cause a lot of that redness. It is important, as we mentioned, to measure your stoma at every barrier change to make sure that you are adjusting it. But we will offer some solutions as we continue through the presentation of what might help should you cut your skin barrier a little bit too large, or should you need something to help fill in those creases and folds around your stoma. And one of the things that we're really finding in the practice of ostomy care on the clinical side of things, so what ostomy nurses are really doing a lot of research and collecting a lot of research around, is a newer product that was introduced into the United States market back in 2018, which is a product called soft convexity. Again, it's something Hollister offers. It's something what other ostomy manufacturers offer. But what we're finding is that soft convex skin barriers are providing a way of taking something right out of the box, putting it on your skin, not having to do a whole ton of additions to it, other than, of course, sizing the barrier appropriately according to the size of your stoma. But what we're finding here is that it's providing the flexibility that's necessary to shape to those creases and folds of your belly as you bend over, as you sit in the chair, as those creases and folds on your belly start to show up. But it's also providing what we call tension in the right spot. It's giving a little bit of pressure, if you will, where necessary to either cause your stoma to protrude. If you've got a stoma that's at skin level or below, that's oftentimes what convexity has historically been recommended for in the past. But also, and it still does that with soft convexity, but something that was not available previously to 2018 was that flexibility. Hollister and other manufacturers have had convex products available in the United States for many, many years now, almost 40 years now. But soft convexity is new. And it's really giving the flexibility required to shape to the bending over and picking up something off of the floor. And while doing so, giving the right tension in the right spot. So whether it is to cause your stoma to protrude a bit, if you've got a stoma at skin level or below, or you're trying to flatten out some of the skin a little bit further away from your belly, again, giving you a better potential seal around that stoma to prevent the leakage and keep your skin healthy, is really what we're finding. So, if you've been experiencing a little bit of leakage and you're in a flat skin barrier or you're in a firm convex skin barrier, it might be a good idea to potentially recommend during your next visit with your stoma nurse, with your healthcare provider, give Hollister Secure Start, give your manufacturer support program a phone call and ask them to help you out, maybe potentially recommend some of those product solutions for you in order to help prevent that leakage and get you back on track, because we want to help prevent that leakage so we can keep your skin very healthy. Some of the potential solutions here. Again, what we'll do here is point out some of the products and talk about how those are beneficial to many of the commonly seen things that many ostomates do experience. So Hollister has ADAPT barrier rings. Every manufacturer has barrier rings. Every manufacturer has stoma powder. Hollister's products are called ADAPT. Barrier rings are used to fill in the gaps, to fill in the creases or folds. Let's say you're measuring your stoma and your stoma's an inch. You cut your barrier and you cut it a little bit too large when you go to put it on your belly. You can fill in the gap with a ring. Rings are an advantage because they don't contain alcohol. So they won't burn your skin if you've got a little bit of a skin breakdown around your stoma. Barrier rings are a great alternative to stoma paste. They help do the same thing. They fill in those creases and folds or those gaps, but paste contains alcohol, certainly in Hollister's formulation. So barrier rings are a great alternative in the instance that you want to use something that's very moldable and does not contain the alcohol. Stoma powder is utilized to help keep your skin dry. One of the important things that we want to recommend when you are applying a new pouching system or a new skin barrier onto your skin is to make sure that it is dry. If you've got some weepiness, if you've got some skin breakdown, stoma powder is the route to go, because what stoma powder does is once you put it on your skin, it absorbs all of that moisture and creates a dry surface for you to then be able to put your pouch right on top of the powder. And that creates that dry surface that your skin barrier needs in order to be adhering well onto your skin. The key with using stoma powder is that you use what's needed. I'm going to exaggerate here, but it helps illustrate the point that if you've got some skin, some weeping skin, some moist skin, let's say you sweat a lot. If you're located in Louisiana, which is where I grew up, the summertime, it's very humid and many people sweat there. So in those instances, it might be a good idea to put a little bit of stoma powder on your skin prior to putting your pouching system on if you've got some perspiration or sweat that's there already. But there's no need to use stoma powder if you don't have some moisture around your skin. Again, keeping it as simple as possible, but these accessory type items like rings, like stoma powder are available to you should you need them. Stoma powder, again, the key here to using stoma powder, and what I wanted to exaggerate with, is if you pour the whole bottle of stoma powder on your skin, the key to making sure your pouch will stick well to that is brushing all of that excess powder off. So you ideally should only use what's necessary in order to get that skin dry. You don't need to use a whole ton, but the concept behind using stoma powder well is to make sure you brush off the excess, because it'll only stick to what areas around your skin are moist anyway. So here's a couple images of people using rings. You can see a ring here has been applied to the pouch to allow that gap in cutting, potentially to fill in the gap around that stoma. And on the right side here, you can see a little infant with a stoma who the clinician there is putting a bit of stoma powder on the skin to absorb those areas of skin breakdown, likely from stool or urine sitting on the skin and causing a little bit of redness, and ultimately creating that dry surface to pouch onto, and then we can put our pouching system right on top of that. A couple other commonly seen things that were mentioned in the description around our presentation was lifting of the barrier edges. One thing that Hollister products are known for is we do have the option to have an integrated tape border around our product. The good news is we have the option for you. If you don't like having that tape border product, we have the options for you without tape border. The intention of having a tape border on our products, however, is to help prevent that barrier edge lifting. However, we do have an accessory product called barrier extenders that allow you to essentially add some level of what we like to call picture framing around your stoma. We want to try to avoid those strong tape adhesives that are essentially looked at as being, a way of causing a little bit of that mechanical trauma potential against your skin. Some people like having the barrier all the way to the edge instead of having that tape border. These barrier extender accessory items are a good alternative to the tape border, or if you even want to add some level of additional security around the barrier, these are fantastic for that. And I'll show you a picture of that in the next slide. Another one I wanted to mention before progressing is for odor management. Let's say you're a colostomate, and typically colostomates have a bit more odor in their pouches because the stool is a little bit more formed in that case. Adapt lubricating deodorant or any lubricating deodorant is beneficial to utilize to put in your pouching system. It does two things. It helps control the odor. So it's considered an odor eliminator. In addition, it's also lubricating the pouch. So if you've got a pouch that you're emptying, where you need to empty, stool a few times a day, this will not only help decrease the odor, but it'll also increase the likelihood that you'll be able to get that stool out of your pouch a little bit easier, because it does add a lubricator. So the next slide here shows an image of that barrier extender and how this particular person added some of those barrier extenders all around the edge of their skin barrier, of the edge of that skin barrier, to help increase the security and to additionally help prevent the lifting of those barrier edges, which, again, using the example of Louisiana where you sweat a lot, this is an example of how some additional security might be necessary, and those barrier extenders help to achieve that outcome. In addition, we mentioned the lubricating deodorant. You can see on this first image here, we have a different vehicle of delivery, if you will, allowed for that adapt a lubricating deodorant or any lubricating deodorant. Hollister offers these smaller packets that are easy to travel with. We've also got, I believe it's an 8-ounce bottle of lubricating deodorant, should you, prefer to keep that at home and utilize it in where you change and empty your pouching system. The key to using lubricating deodorant is to use enough. We do recommend about a tablespoon or so, half a tablespoon or so to a tablespoon of that particular product into the pouching system. And as you see in image 3 here, where you kind of swish it around a little bit, you take that lubricating deodorant and help coat it all the way around your pouching system. And that'll make it much easier to, again, as you go to empty, the contents of your pouch should be able to come out of your drainable pouch a little bit easier. And then lastly, a couple other accessory items to mention that oftentimes help with some of the more commonly seen complications. Ostomy belts, if you're already using convex products, 1-piece and 2-piece products from Hollister do include the belt tabs on the pouching system where you can attach an ostomy belt. The intention of an ostomy belt is either to help add some security, for your peace of mind, to ensure that should that adhesive quality of your pouch be compromised for any reason, that ostomy belt will help secure or give you that sense of security, and certainly to help even enhance that level of convexity. If you're needing some level of protrusion to your stoma or helping to increase that tension that is necessary to cause your skin around your stoma to flatten out a bit, ostomy belts are a great application. And you can see here on this slide is just an example of a Hollister ostomy belt, along with that little belt tab that's located right under the edge of that lifting of the tape border on this particular example. And then over on the right here, the universal remover wipes. Remember, one of the things that we said earlier that contributes to some of the skin complications and skin breakdown can be that mechanical trauma that's associated with any adhesive on the skin, right? Whether it's a hydrocolloid adhesive, whether it's a tape border adhesive, whether it's a barrier extender adhesive. Universal remover wipes, whether it's a Hollister brand or another brand that you're utilizing, they're intended to help remove those adhesives. And if you've got sensitive skin, it'll help decrease the effectiveness or the likelihood, if you will, of that skin adhesive, causing more mechanical trauma on your skin. So it is a good idea to use those universal remover wipes should you have experienced some, skin complications after removing your skin barriers in the past. And here's an example, just a quick image of the modes of delivery that Hollister offers in the Hollister specific portfolio. On the left, you see a spray that allows you to spray the adhesive onto the skin, or universal remover wipes in a wipe delivery, where it's kind of like an alcohol pad where you tear the top open and you can utilize that on your skin as well. The key to using universal remover wipes is to ensure that you allow the remover to dry. You don't have to worry about wiping it off of the skin on the Hollister end of things, as long as you allow that remover wipe to dry. The film that's left on your skin, as long as it dries, it will not interfere with the next pouching system that you put onto your skin. So that was a quick overview of, some of the commonly seen things related to leakage, related to trauma, related to barrier edge lifting, related to odor management, related to removal of the pouching systems. And lastly, I wanted to end, before we entertain some of your questions, with it really is about keeping your skin healthy. Because if we can't keep your skin healthy, the cycle just continues where, we're troubleshooting all of the time. We're trying to figure out what's the best solution. And there is a little bit of trial and error, of course, in ostomy care. Everyone's belly is different. So sometimes what works for one person may not work the best for the next person, because all of the shapes, creases, valleys that we find in our bellies are a little bit different. But some unique combination of all of these things that we've talked about today will help. Hopefully, if you are currently experiencing a skin complication, please rely on your manufacturer, your ostomy nurse that you work with at your health institution, wherever you're finding care. Please rely on us to help navigate you through that process should you need some additional support on that end. But it is, again, finding the right products to help you achieve that outcome and ultimately keep your skin healthy, helping you maintain a good quality of life, Maintain that easy removal of your pouching system, where keeping your skin clean is easy in whatever method you find beneficial. We certainly recommend the most simplistic method for cleaning your skin, which is take the barrier off and use some nice warm water. Learn how to measure your stoma. If you're a newer ostomate, rely on your manufacturers to help provide the resources, or your clinical ostomy nurse within your institution to help, provide you with those resources. Adjust the template of your stoma size according to the size of your stoma. We don't want any skin around your stoma to show, so we can help protect it the best way possible. And then, again, help keep your skin healthy by preventing the leakage, using products that do help promote skin health. And that's really ultimately what it's all about for us. Certainly as a Hollister supporter and a nurse, an ostomy nurse in general, our goal at the end of the day is to make sure that we're supporting you with the things that you need to live your best life. So I will go ahead and end there. We thank you for your attention today. We thank you for your participation, and I'll certainly look forward to Adam's help here with any questions.
Thank you. Excuse me. Thank you so much, Will.
My pleasure.
Presentation. We do have a few questions here I've gathered, and if any more come to mind, please feel free. So I have first Jagat. I apologize if I'm mispronouncing. They ask, any tips for caring for a skin ulcer adjacent to the stoma?
Skin ulcers adjacent to the stoma. Yeah. So typically, again, I'll supersede and disclaim everything that if you've received recommendation from your health system that you've had surgery, or your ostomy nurse that you interact with, please follow their advice. Certainly that supersedes anything that I will recommend to you. But, typically for ulcerations, we try to pouch on top of them. You want to try if there's any type of weeping that you might have from that ulceration, if there's anything your clinician may have recommended as far as absorption of that weepiness is ultimately something we first want to consider. So a foam as an example of any kind. Again, whatever your clinician may have recommended to help manage that weepiness, if you've got any output from that ulceration. But it's important for us to keep either stool or urine out of that ulcer around your skin. That is, of course, the ultimate goal, because without preventing that stool or urine from getting into the ulceration, then we just continue the cycle of continuous healing, avoiding infection. So, the simplistic recommendation is you would pouch over it. With keeping in mind there's some need, if you've got a lot of weepiness, you can use stoma powder in there to help absorb some of that moisture, but ultimately we're going to pouch right on top of it. So maybe a general answer, but first we think of how do we absorb any fluid that would come out of that ulcer, and then pouching right on top of that.
Makes sense. We have the next question is from Sue. She asks, what is the typical length of time between changing pouching systems for an ileostomy?
Again, also something that is kind of a what if, and every person is a little bit different. Typically, the average wear time has been anywhere from 3 to 5 days. And, we say that very lightly. Ultimately, that's what I think we try to get you to. As an ostomy nurse, we try to get patients to a predictable wear time, if nothing else. Oftentimes, skin complications will interfere, as an example, with the capability of having a pouching system on that long. Ileostomates oftentimes will have more liquid output than colostomate, as an example. If you're living in an area like Louisiana in the South, that's in the summertime pretty warm. Even, where I live in the Chicago suburbs, it's pretty warm this time of year. I guess across the country this year, it's been pretty warm everywhere, right? All of those things are factors in how long your pouching system might last. But I think ultimately the best outcome and time frame I can give is it's really dependent on you and the factors that present, but we try on average to get people to a 3 to 5 day wear time. And remember that, a piece of wear time is also making sure we allow you the capability of observing your skin. We hear some people can wear their pouching system 7 days. That's great. We don't typically go longer than that because we want you to be able to see your skin underneath. And that's an important piece of wear time, as well as making sure that you have enough time and spend enough time looking at your skin.
Alrighty. Michelle asks, can the barrier ring go right around the opening, by which I think she means the edge of the stoma? My ostomy nurse said to put it about 1/4 inch back from the edge.
Yeah, and again, there's a little bit of variation into what some clinicians might recommend based off of practice experience. Again, I'm giving the majority of my recommendations based off of my experience, based off of what we recommend with Hollister products and our instructions for use. On the application of a skin barrier ring, you can certainly do one of two things. You can either put it on the back of the pouching system itself and put it onto the pouch before applying the pouch directly to your skin, or you can put the barrier ring onto your skin immediately around your stoma first and then apply the pouching system afterward. It really is preference. That clinician may have instructed, based off of their preference. You can certainly put the barrier ring about 1/4 inch to the edge of where you cut your pouching system. The good news that I would say with barrier rings is that they're flexible. They allow you the capability to kind of shape and fold things as necessary, ultimately to make sure that we get that secure seal around your stoma, which is, paramount in making sure that we prevent that leakage around your stoma and really prevent that stool or urine from going into the creases and the folds. So I hope that answers your question. It really depends on your preference and some of the landscape of what the skin around your stoma might look like.
Alrighty. I think we have time for one or two more here. This one is just in a moment ago. It looks like Diane asks, cis has severe gas overnight, is disabled, can't burp the bag. I've tried extra filters. They don't seem to work. I get up 2 to 3 times, but still miss the one that causes the bag to explode. Diet med solutions have not been found. Any thoughts?
Yeah, Diane, it sounds like, one of those challenging situations. I would, of course, assume that there's first recommendation would be, of course, to use a filter pouch, a pouch with a filter. There are accessory filters that you might want to consider additionally to add on. It's not something that Hollister offers. There's some other companies that do offer accessory vents that you can add to. It might be beneficial to try adding something, just as an additional filter to have 2 on there to see if that would help. The secondary thing that I would, of course, recommend is the burping of the bag, which, to your point, if it's excess gas, that may be difficult to do, especially during sleeping time. Something as another consideration potentially could be, and this is, of course, depending on if the stool is a certain consistency. Sometimes bedside collection systems can help, certainly at least during the night. But, the caveat to that is if the stool is too thick, sometimes it can have a challenge passing through anything that might be connected to the bag, to that ostomy pouching system that ultimately would then have a tube that leans to the side that you can ultimately hang on the side of a bed or a, wheelchair. If the patient is in a wheelchair, the ostomate is in a wheelchair. So all of those things being said, what I might suggest, just to talk through some of those troubleshooting items specific to this instance, would be if you're in Hollister, reach out to Secure Start. If you're not in Hollister, you can certainly still reach out to our Secure Start program, or I'd recommend, reaching out to whatever company's products that you're in to see what solutions they might be able to offer.
All right, and I think we'll do one more here. Sorry, I'm just seeing which one would be the best. Okay, let's see. Peggy asks, can you use a ring along with the Sarah Plus Soft Convex, or does that cause too much pressure on the skin around the stoma?
Another great question. All of you, thank you for your questions. That is something that we are finding, again, as a benefit in many instances, where we certainly do recommend the use of a ring in addition to the soft convex products. There's a few different characteristics that many clinicians talk about when we talk about convexity. Depth is one of them, where sometimes patients have creases and folds where we need a little bit of extra depth to the product in order to be able to create that good seal around the stoma. And a way to create additional depth is to add a convex barrier ring or a regular barrier ring. So yes, there are instances where it is certainly a benefit to add rings, whether it be a slim ring, whether it be a regular thickness ring, or even convex rings, whether they're round or oval convex rings. Again, adding that to convexity in some instances is certainly warranted and can actually benefit either causing stomal protrusion or creating some level of flatness around that stoma, the skin around the stoma, in order to create a better seal. So yes, again, one of those instances where if you don't have access to your ostomy nurse, within a decent time frame, something that one of the patient support programs can certainly help out with.
All right, fantastic. That's all the time we have today for questions. I'm sorry we didn't get to all of them here. I know I see a few of you guys have questions about specific products. I would actually encourage you, Medical Monks. We can answer any product specific questions you have. You can actually give us a call, 844-859-9400 during business hours, or go to medicalmonks.com. You can see the different ways in which you can contact us, email, live chat, etc. We can answer any of your product related questions there. So that said, thank you so much, Will. We really appreciate you. It was a fantastic presentation there, and thank you all for coming as well. And if anybody would like to see wants to see this again, you're going to be receiving in just a few hours an email with a link to the video recording. If you came in later, you want to see the beginning, etc. But that's all for today.
Thank you, everyone. Thank you, Adam. And thank you to Medical Monks.
Yes, and thank you to Hollister, and thank you to Will. Have a great day, everybody.
Bye, everyone.